My name's Phil Locke. I'm a bariatric surgeon. I've been involved in bariatric surgery now for 15 years. In the past, bariatric surgery has been sort of regarded as something you did at the last resort if you'd failed all other options. Increasingly now, because we're able to carry it out in keyhole fashion, in a very safe fashion with a low risk, there's been a move that we should really be considering it at a much earlier stage, particularly for patients who have weight-related comorbidities such as diabetes, obstructive sleep apnea, cardiovascular disease. Even amongst the medical community and GPs, there has been a traditional reluctance to refer patients for weight loss surgery. There's still this feeling that if you are overweight or obese, it's a lifestyle choice, it's due to poor food choices, it's due to lack of exercise. The data from the NHMRC in Australia still shows that if you go on a diet and exercise regime, you're going to lose about 7 kilos on average in the first year, but by the end of the second year you're down to about 3 kilos. So I would argue if you are 110, 120 kilos, losing 3 kilos over a 2-year period is really not very spectacular and probably a bit of a waste of your time. In that situation, I'd much rather have patients referred early to consider weight loss surgery. I'd much rather operate on a patient who is 100 kilos with a BMI of 38 than operate on somebody who's 200 kilos with a BMI of 50. We can still produce excellent weight loss results, but the surgery from my point of view is much easier if you're at a lower BMI, and the data would suggest that having had the surgery at a lower BMI, you're more likely to keep the weight off in the longer term. As I've spoken about in my introduction, there is increasing evidence now that even if you are otherwise well and obese with a BMI of over 30, in the long term, you have an increased all-cause mortality. About a third of patients with a BMI of over 30 have been shown to become diabetic over a 3 to 5 year period. So again, I think that's another reason why we should be considering intervening at an earlier stage to deal with the weight issues. In an Australian context, the current evidence is that despite the results from bariatric surgery, where we're looking at 75 to 80% excess weight loss sustained over a 3 to 5 year period, the average referral rate from GPs is about 1 patient per year, which I think is very low. I think we should be doing a lot more.